Thank you very much for the opportunity to disseminate one of the university policies to you this day. We are policy group D. Group D. We are policy group D. And we've been tasked with disseminating to the university community 4 policies. The health and safety, what we're bringing you this morning. And then there's the disability policy, the gender policy, and the anti-sexual harassment policy. We've done some rounds in some other colleges already. We hope that somewhere down the line, you will invite the Group D policy group again to have a look at the other policies. But today, yes, we'll bring to you the health and safety policy. And Dr. Bhavana Singh from the University Hospital is the one who will lead us in this discussion. But I would like to first make a disclaimer. The university has a raft of these policies, okay? And it has selected some people to lead the dissemination of these. So the first disclaimer is that we did not write this policy. Okay, we did not write this policy. We've just been picked up to disseminate what is in it. But for me, most importantly, it is not only knowing what this policy says, but also importantly, what else probably needs to go into the policy to make it better. Okay, so we will solicit this from you. The policies also, apart from giving us certain obligations, there also should be some obligations on the part of the university to making these policies work, okay? So if there are some of these that you do not find in place, it's important that you also point these out. One of our roles is to pick these comments from you to inform the university management as to how this can be implemented. If it's not being implemented well, how well that could be done, and any other suggestions to make this policy better. There will be another edition of this, so we pick up these comments from wherever we go, and we forward these to the university management. So Bhavana will speak to us this morning. Thank you.
Good morning. Sorry, it's afternoon. As Prof mentioned, I am only coming to disseminate the policy that the university has already put in place and to also make you aware that something like this exists. So after the presentation, we'll take your input and we would carry the message forward. Yes. So the health and safety policy. The health and safety policy is a written statement that clearly outlines how the health and safety is managed in the workplace. So it actually shows the university commitment to the health and safety of the people working for them, and it lays down the details of how employees can benefit from the same. And to introduce the KNUST, the university acknowledges and accepts that there has to be such a policy, and it has taken this responsibility under the section of labor law, section 118. And also the Occupational Health and Safety Law, Act 651. And the university is acting positively to minimize any incidents at the workplace via our commitment to taking all responsible practical steps to protect the health and safety and welfare of our workforce, the students, the service users, and others who might be affected by our activity. So why this policy? The importance of the policy is that there should be a well-defined health and safety strategy at any workplace where people are working to ensure that every system is in place to reduce frequency and severity of accidents associated with our work. And it also is important because we have to maintain the workplace safely to ensure that there are proper instructions and safety requirements that has been adequately provided to prevent any hazardous implications. And we all know that if there are these policies and structures in place, fewer injuries occur, and that will enable a less cost to the staff, and so less downtime and improve efficiency. In line with this, we must maintain a detailed record of hazards and actions taken. And these records in the future help us in monitoring and auditing and regularly reviewing the policy so that we can improve our policy to enable a continual success. And aside the university having this commitment, we also wish to inform that we as the workers and the students and the other people who are actively engaged in the workplace have a legal and moral right to also ensure that these policies are effectively taken care of. I'll give a summary of the key policies of the KNUST. The university provides all staff and students with the suitable information, the instructions, and also supervises and trains us to ensure that their work and studies are carried out safely and competently. The university also ensures that every student and staff is aware that they must cooperate and with us to ensure that there is a successful implementation of this arrangement. The university also ensures that the place of work and study are safe and without any risk to the health, and therefore adequate arrangements have been put in place and means of access and exit are clearly defined. And we also ensure that the risk and hazards, such as handling of heavy goods, storage spaces, transportation of articles and goods, contamination of workplaces, are clearly identified by the university and should be minimized to prevent any impact on our workforce, the students, the contractors, and other parties. The adequate precautionary measures and provision of basic necessities, such as availability of clean drinking water, suitable toilet facility, adequate facility for storage, suitable firefighting equipment, are all taken into consideration and provided by the university to prevent ill health, injuries, and incidents to our workforce and students and other parties. There is also the provision of an applicable legislation as well as a health service management system in the university so that the employees, the students, services, and other parties comply with them. We also provide sufficient occupational health arrangements, including workplace well-being. So there is a hospital to ensure that the persons against ill health is clearly defined and they are protected. We encourage consultation with staff and students on matters affecting their health and safety so that they are involved with the planning and the measuring and reviewing of our performances to the policy. There is monitoring, audit, and regular review of this policy and measure safety performances to enable continual improvement. The details of the policies can be accessed at the website given, and hard copies of this policy is also available at the university library and the various colleges. And in conclusion, I'll say that KNUST is committed to providing all the necessary means and resources for a healthy and safe working environment. And it is our responsibility as workers, students, and service users to ensure that they work in safe manner in accordance with the Occupational Health and Safety Act. And we should ensure that all applicable regulations as well as safety programs are set by the university. Thank you.
Okay, thank you, Bhavana, again. See, I often call this policy workplace well-being. Okay, and there are many workplaces here in the university, and what we need to put in place depends on where you work. So that it is important that this particular unit in the university, okay, looks at its working environment, what each of us does, okay, and what is important for us to put in place so that no untoward health and safety issues come about. What I'll put in my department, okay, to mitigate health and safety issues will be different from what you put in your working environment. So then our responsibility here is to have a look at the environment. Yeah, there could be generic ones that relate to all of us, but specifically within where we work, it's important that we have a look at that working environment, try and list all health and safety issues. And I'm glad that we've been speaking here after Professor Brahma's group, which has basically talked about risks and how we mitigate risks. So then what are the health and safety risks in the environment we work? How can we mitigate these? And it is for the unit to have a look at this and come up with something and see how that could be implemented. This is a generic policy for all of us, but we all need to work within it, look at it within our environment, and see what we can put in place. So that's the work the director needs to be doing with you all. Let us identify what risks in terms of health are, what are some of the safety things we need to put in place, and how can we put this into place so that we mitigate any negative effects of these risks. So I think this is just a summary. So if there are any questions, we will try and answer them for you. Thank you.
Hello. Thank you very much, Prof. Thank you very much, Doc. I want to hint that our director is around, so that if you want to direct some missiles to him, he's here to take the missiles. Thank you very much.
I mean, the director doesn't work in your environment, does he? So what happens in your office, whatever risks there are in terms of health and safety, you need to address that. Okay.
So I have a question. How do you marry the health and safety issues with this particular clause in our letters and any other responsibilities assigned to you by your HOD or the Vice Chancellor? So if my HOD tells me to move something that is hazardous, what do I do?
I guess we are all rational beings, right? I should think so. Okay. So that we should all know what it is that we do that can negatively affect our health. We are not zombies. Okay. And so that it's important that your head of department cannot come and tell you that as part of your, they say that, and any other thing I tell you to do. Okay. What is the risk involved in what I'm telling you to do? And should you necessarily do it because I've said you have to do it? This is how I look at the situation. And there are avenues that can address those. Should you refuse to do that? That's just how I answer it.
All right, thank you. I understand that in your submission, you said that the unit itself, maybe led by the director, can assess the environment and come up with things we deem risky to our health and maybe present it. Is it also possible that the health services unit come around the various units, maybe assess the various gadget devices and the working environment and recommend safety measures or maybe come up with ways and means of mitigating some of the risks that are related to our health?
You know, my thinking, I don't know what you think, Bavana. My thinking is that, look, I work in the Department of Clinical Microbiology as a professional, an expert in that. Okay. We work with our students, and our research involves the use of infectious microorganisms. Okay. I'll be best placed to know what the risk is working with these things, okay, than getting the University Health Services to come and evaluate that for me, okay. So I pick up the risks. I should know what mitigations I could put in place. Yes, there's a place for some general things that they can do. But I think specifically in our unit, in our offices, we are best placed to have a look at these than an external force. That's my thinking in this. Okay. The guy from geodetic engineering comes to your office, he looks around, look, what are the effects of constantly sitting behind a computer and then doing what? You may know more about that than the guy who's come from petroleum or anything like that. So we have a part to play in this.
He said, any more questions?
Thank you very much. Please, I don't know whether my colleague was trying to bring this point out. You know, there are health experts. We have health experts, and we are not health experts. So there's a likelihood of we not seeing what is a real health risk. For instance, most of us sit behind our computers for God knows how long, for long hours. And we call it focus, or we call it achieving something. But then you will come in and see us sitting behind, and you then identify something wrong with us. It's probably going to even affect our way of thinking, but we don't even know. So that's the angle I'm coming from, please. Thank you.
Okay, I mean, I understand the aspect. I mean, that important, we have an occupational health unit.
Yes, but there's no officer there.
Okay, so that's another thing. At least we have programs in occupational health in this university, yes, in the School of Public Health. Okay, so that in other words, there should be specialists there, okay, who know more about these things, right? So I understand where you are coming from, but also importantly, whatever they come with, etc., will need to be discussed together with those of us who work in those units as well. I mean, if you are laying cables across the floor that crisscross and somebody can trip on it, this is something that you can see and mitigate. So I guess that there are various issues that units can look at and address themselves, and there should be the bigger overwhelming whatever, which may be some specific health issues that you may not see. Actually, see, I see a research issue here, Bhavana. I see a research issue here that you can get a student to have a look at. So yes, thank you, Emmanuel.
It was a question I wanted to ask, but so example, I sit beside servers the whole time. I went to my director one day to complain. I did physics, so I was thinking I'm exposed to radiation. The follow-up was I should get someone from atomic energy to come and measure.
So you know this?
No, I should get someone from atomic energy to come and measure.
No, what I'm saying is that so you know this risk.
I think I know the risk. Yes, that is what I'm suspecting. I suspect, but I can't put a finger on whether it's true or not. It's just an assumption I have in mind. Yes, so there's a sound, there's radiation, so I thought there was a risk involved. But the response was, because in the environment we live in, some of the places are new. The work we are doing, they are not the traditional systems. So sometimes we ourselves don't even know the risk. Maybe for me, I have to come to work 3 times in a week to mitigate the risk involved in sitting behind the servers. Maybe that's me, but I need an expert to come into the system to tell me that. So that is what we are trying to put across. We need professionals to come around, assess the particular risk we think is there, then tell us what to do about them. Thank you.
Okay, that's why I would go back to what Prof said in the beginning, that this was a generic health and safety presentation, but every unit has their specific risks that they can identify. Like in the hospital, an X-ray department, we all know that there is radiation, emission of these bad rays. So we called Atomic Energy to actually come and identify, how bad the rays are and what measures should be put in place. So they tell you we have to have leaded walls, you have to wear protective gowns. So I think based on the service you are using, I believe there are manufacturers' instructions as to how much radiation is being emitted. So maybe your head of department is right. So we can call the Atomic Energy to identify if the radiations are very risky or they are just enough for a normal layperson to absorb. So yes, so you should identify what needs to be done. So as Prof said, we should identify the specific risk in every unit and then work accordingly. And then we can design a health and safety policy for that specific unit. Prof, anything else?
I see what you said and where you're coming from. Like I said previously, you need some professionals to help you identify certain risks. But I also go back and say that for me, I think that if we are professionals working in whatever environments, there are certain things about health and safety, some basic things that we should probably know, okay, and identify, and if we need to seek help to address them, that could be done. So that I go back to the point that the units, the individual, they need to be working together with the university's, in quotes, occupational health group to try and see how some of these issues should be mitigated. All I'm saying is that there are some of the risks you can see yourself, okay? And those, you may need help to mitigate those, or again, you can do that within your own unit.
My question is, we have various food vendors around. So is there a team or people who are assigned the responsibility of going around to ensure that food is cooked in a safe manner, and then people are eating in a very good environment? And apart from that, too, there's also the issue about washrooms. We have lots of them. And some are not so good, some are good. And it's led to a situation where people actually now keep keys of washroom, which is, to me, it's not something that should happen. A washroom is a washroom, it's a public space. If you go outside, you don't see that. You can just walk to any washroom and then use it. But here, they are locked up. And even the locked up ones still, some of them still smell very badly. So if you have a policy like this, who is checking to make sure that this is implemented? And we are a high-class university, I believe. So at least we need to have some team in place looking to make sure that things are done right in this regard. Is there any team like that? I think I was doing a little bit of both, but my question is that do we have...
I think I will eventually come there. But you see, I think that there are certain things, wherever we are, that we need to be taking responsibility for. Okay, if we use a toilet, okay, just example, and there are necessarily certain things that we can see that need to be addressed. What I'm asking is that should an external force come and have a look at it and see how that could be mitigated? That's just on that. There are certain things I think that we should be responsible for ourselves and not get somebody to come and, the worst thing is for a superior person to come to a unit and then that person goes into a toilet and there's a problem. Whose responsibility is it? That higher authority? There are certain things, that's what I'm thinking about. There are certain things that we should be responsible for ourselves. So those are some of the things we need to do. Like, but there are others that I think that's important that you get support from high up to deal with. But what, I mean, the food safety issue.
Yes, I know that the food vendors, even before they allocated the spaces, I think they go through the EPA inspection wherever they are establishing. And the workers or the cook, they pass through a health screening to make sure that they do not have any infection that they can pass through. So they go through a health screening. But I don't know how effective it is for those who are selling the food at the university. I don't know. And who is responsible to, I don't know.
For me, there's a bigger issue you have raised. Okay, food handling is important. But like I've always said, when we disseminate this particular policy, is that at the level of the university itself, in terms of occupational health, okay, I think really, and this we talk about always, we haven't looked at addressing this from the top, okay, and letting it trickle down to other units in terms of what they need to be doing. I mean, in some occupations, you go there, there's an occupational health unit. You're supposed to do, look, if they say go to the hospital for these, your checkups every so often, I mean, that is part of an occupational policy that is supposed to lead to our well-being here. But I think they also just dotted here and there. Let us go for walks every one Saturday in the month. Let us do this. But maybe that needs to be streamlined very well from the top. So there are some aspects of what you've said that I think need to be addressed from. But we also have some responsibility here.
Thank you. The name of this policy is Health and Safety. Okay, so I'm just trying to clarify some aspect of physical safety. For example, physical confrontation. Let's say the risk of a physical confrontation by a student towards a lecturer in a lecture room where it's violent, it's physical. Is that here or it's more of a security policy? Okay, the second one is supposing you identify a student or a staff who is visibly ill and you can see maybe he looks very bad, watery eyes, something that looks visibly bad. Who is supposed to take responsibility for that person walking around? Can anybody just walk up to the person and confront the person? Are you supposed to escalate it to a higher authority? And if you are, who is it? Is it the hospital? Is it security? How do you take care of that? And related to something of this issue, since COVID is still evident, we are still dealing with COVID, what is the official enforcement for violating COVID protocol, if there is any? Thank you.
Okay, thank you. My reading of this policy, which policy we all need to read and be abreast with. Okay, but all these policy groups going around are making us aware of this policy. Okay, but I think primarily it is our responsibility to read the policy and understand the policy. A lot of the issues in this document deal with what are the structures we need to put in place, okay, for our well-being, so that it's like the university gives you an environment that you can work with. In the policy, there's a committee
and safety structure. And I think it starts with someone who identifies, as you said, the ill person. The next person should be your head of department, and he should also communicate it to a higher authority. There is a structure, but I don't know the details, but it's in the leaflet, yes.
But we do realize, I don't know what you've seen in your policy, we do realize, that's why I'm saying that within all these policy documents, there are certain committee structures the university needs to put in place, okay, to help implementation of these policies, okay? And many of that, at least in the policy we are looking at, we realize that many of those committees are not up yet, okay? So these are some of the things we remind the university of, okay? And as we come around and you also mention these things, we need to reinforce it, okay? But I think it's important that we all have a look and read and understand that policy after these awareness creation events, okay? So that again, we'll be able to bring forth some of the things that are necessary for the university to put in place. That's just what I think I can say here.
All right. Prof, thank you very much. Thank you, Doc. Please, I want to find out, a question was asked about food vendors, but I want to ask a question about the quality of food. The quality of food, because, in fact, my wife told me something that if you go, you're going to buy food from two vendors, and for one vendor, you see a lot of ladies join the ladies' line because ladies have a taste for good food, and then guys don't. But how do we determine the how do you determine the quality of food on campus since we are what we eat? And then also, speaking of health and safety, I think health, it comes with, it's expensive. I don't know whether it's right to say it's expensive to keep a good health and to keep safety. How can we make the university understand that for us to have, for instance, UITS, we want to have a recreational room where there's an Xbox and something to just, and the university will say, no, this is not, how can we sell that idea to the top level management? Thank you.
But Emmanuel, you answered the question that if you want to see quality food, join the women. You need to answer the question. But again, I mean, quality is what? Yeah, he says it's in the eyes of the beholder. That's what he just said. I mean, something that is you think is quality, okay, may even be junk. Okay. I mean, I say that we are pushing our children. There's a KFC joint here. So that's the in thing. Everybody buying what from McDonald's, from KFC. I call those foods junk. But they taste nice, don't they? Is that what is quality? So again, some of these issues boil down to ourselves and our individual knowledge about certain things. I mean, yeah, for recreational purposes, we all need to be provided with something that will relax with in the workplace, etc. But again, this is what unit departments can identify and see how they work towards it. I mean, some units may have some money generated from somewhere that they can use this to do what, I don't know. I mean, but it's just that we need to be thinking about how within, you see, if you leave something to the hierarchy, the top of the university, when they're doing anything, they need to think about doing it for everybody. Okay. But if at our level, we can identify something, we can work towards raising funds for it, then we don't, you see something have some things, positive things in certain departments, you wish you could have it, but they're not be provided for them by the university. They have to look for certain funds somewhere and provided that activity or whatever incentive for their workers. So I know I haven't answered you well, Emmanuel, but those are just my thoughts around it.
Okay. Thank you, Prof. Yes, please, I would like to know what health and safety policy does concerning the buildings that have been put up at the university campus. I know most of the buildings were put up way before maybe this policy was set. But as it stands now, the university keep building. New buildings are coming up. So I want to know if there's a place where the policy covers and look at new buildings that are coming up, the health and safety of some of these buildings. Because as it stands now, I know we have a couple of working spaces whereby there are no extractors, there are no proper ventilations and all of that. But then you have human beings working from these spaces. So I want to know if the policy look at some of these things, because in terms of ICT infrastructure, you may have to look at architectural drawings to know which kind of ICT infrastructure that you want to deploy for a certain building. So does the policy look at some of these things? And I know if it does, it will go a long way to help us. So that's what I want to know. Thank you.
Thank you. I think you've touched on a very important issue. The relationship between unit departments and, for example, other working services. I mean, we need a structure. Architects from the development office sit down, do this, do that. How often do they sit down with us to discuss these things? Because we work on the disability policy as well. Okay. And then you look at structures within this university and how disability friendly they are. Okay. And whether we're even responding well to Act 715 of the Constitution, what's the whole disability issue. We are found wanting in many of these, and as a university, we can do better. Okay. By cooperating very well, working with whoever, but we seem to work in silos a lot of time in this university. And I think collectively, it is our responsibility to try to push all these along. Because before we put up any structure, we know that it's going to be put up. But we tend to leave this to the development office to do all this for us. And they call us for site meetings, and we follow. When the structure is finished, then we say that, but there's no window here, there's no this there. These are some of the things that we could have helped with, or we should be invited for at the initial phase when all these are being done. So we have a difficulty with that, but I think it is both our responsibility to help look at some of these and bring some of these up. Thank you.
Prof, thank you. Please, this is a scenario I witnessed. Once upon a time, I was standing somewhere, and then I saw a group of students around a woman. Apparently, she had an asthmatic attack. I want to ask, how well do we conscientize staff of the university to respond to certain things, certain health conditions of fellow staff? It could be epilepsy, it could be anything. It could be heart attack. How do we respond to such? That's a citation. Thank you.
Yes, there is an emergency response team from the hospital, and I think the hotline numbers are all over. So if you are aware and you read the notice boards, you would see these numbers. So you know who to call, ambulance or the experts. So we easily come on site and pick these patients and send them to the hospital. Otherwise, I don't think we can train individuals to manage individual conditions. I don't know, Prof.
Yeah, but you see, it also raises a fundamental issue. How many of us know those numbers? How many of us know those numbers? I mean, we should be able to go to not our website, even offices, our secretaries' offices, okay, and find certain emergency numbers there, okay? In case of fire, do this. In case somebody collapses, do this. In case of, I think these are important numbers for us to have. And also, I think one important is in terms of training for, I think we discussed before, first aiders. First aiders, those can be trained in for every department who may be the points of call. And in many cases, look, we sure we know how to do basic resuscitation. Okay. So I think for me, these are some of the things coming up are these things, and there are some of the things we should think about and carry forward. That we should all be able to do basic, simple resuscitation, ABC of what, before, whilst we are waiting for you to bring the ambulance, we do some of these things. We want to be a world-class university. So those are some of the things we need to be thinking about, really.
Okay, please, do we have any more questions?
Okay, please, shall we give it up for Prof. and Dr. Sine? They've done an excellent work. Indeed, we are all richer to be here than to be elsewhere. Without wasting much time, we have a director in our midst, but then he will come after Mr. Akote Azu, the Quality Assurance Committee for UITS head, gives us a summary of what we've learned today, and then after which we'll take some other announcements. Thank you. Shall we give it up for Mr. Azu? Thank you very much, Prof. Thank you, Dr. Sine.
So I would say it's been a very good day in terms of what we've learned here, especially for risk. And risk actually cuts across everything, even for the second session. It's mainly about what? Risk, and how you would control the risk. We learned about identifying risk, how to prioritize the risk in terms of its likelihood, and then the impact. And then if you identify the risk and you think it's very high, you should put in place mitigation measures to reduce the risk, so that even though the risk is reduced, it will not be eliminated. So that in itself says that we cannot eliminate all risk. And like Dr. Boama indicated, every business exists because of some propensity to take risk. If you don't take risk, then you will not survive as a business. KMC takes many risks every day. They decide to maybe run programs. It's all a risk. And sometimes it doesn't go well, so the program is cancelled. So as for risk taking, it would always be a part of us, but we should know how to prioritize it, how to mitigate it, and how to more or less move on from something that you think is not worthwhile. So these are very important things to know. And also, what I also learned from it is that in all the work that we do, we should try and think about the risk of everything we're doing. So you are designing a software. What are the implications of the software if it is breached? Which area should I focus more on? Because it's if things don't go well on that side, it has implications for the university. So you focus more of your efforts on those sides. If you are deploying a server, it asks you create an architecture for a server system. You should keep in mind that this system that I'm deploying, it's possible that something might happen and it will go off. So what do I do in that scenario? I should think about alternatives that will make the system more resilient. So we have to always think about risk in everything we do and try and prioritize it and try and organize it so that we focus on the more important things before we go to the low risk items. So and like also Prof and Doc indicated, we also need to be able to measure the risk, and there always has to be a framework. And this is one framework that they gave us. I believe there are other frameworks, but this is what the university is adopting. So I would entreat everyone to look at it again. And then one of the good things that we did here was to identify some of our risks here. And I think we need to reconcile that because people have different measures for the same risk. So as a group, we need to reconcile that, have the discussion, and then fine-tune all those things to come up with a local risk register. because we do have a universal risk register, which is at the university level. We contributed to that, but in our various units, individual units, we have to what? And try and come up with what? That register, and then consolidate it for what? The entire units. And also, one of the things that the risk in itself, they should not exist on their own. They should be linked to something. The strategic objectives of what? The university. And maybe for us, it should be linked to the strategic objectives of what? The unit, which is in turn linked to what? The strategic objectives what? Of the university. So if you can't link it, then maybe it's not really a risk. If you can't do that linkage, then it's probably not worth what? Considering. So that's the little I have to say on that. And also, regarding the health and safety, I think that it's important that we work in an environment that is safe, that is conducive, and an environment that everybody wants to come and work without feeling that what there's something about the environment that will harm what they do. For us, I think most of us sit for very long hours. So the obvious thing is that the chairs we sit on, are they comfortable enough? Are they ergonomic enough? And then the screens that we use, is it good? Are the radiations from the screen, are they harmful to our eyes? Can we get screens for our machines? So those are questions that we need to ask. And if we decide as a group that we need to do that, then of course we'll make that request to our director, and then what? You act on it. I touched on some of the other things, something about supervision of, or more or less, how do we ensure that the health policy is being implemented? And my suggestion was to have like a team. You know, in the district assemblies, they have what you call environmental officers. I think they go around to check the food vendors to make sure that the environment is clean. Just as in the past, they used to have this town council. When they say they are coming, everyone is scared. So that is my thinking, that if we have such people who go around occasionally, then I think that knowing that people will come around spontaneously to check on what they do, that would help to what? At least imbibe in them some sense of responsibility in what? Delivering what? A good service to us. And then lastly, things will happen, accidents will happen. So we need to have a quick way of responding when they do happen. So the suggestion is that we should have emergency numbers, especially in our offices, so that as soon as the event happens, we can what? Quickly call whoever can help us, and then what? Help will come. And on that note, I would want to end here. Thank you very much.
Thank you very much. At this juncture, we'll call upon our director, Mr. Emmanuel Afo, to give us his word. Thank you. Please, a round of applause.
Good afternoon. Yeah, so to Prof. Yadusa Akodi team and then Prof. Imro Brahma and team, we thank you so much. It's been very insightful listening to you. One of my big takeaways is that this implementation of this is a shared responsibility, and we need to internalize it. So within the units, we need to make sure that when it comes to risk management and then the risk register, we do one that is local to the unit, and then of course, report up. Then as well, when it comes to health and safety, you don't wait for somebody to come and tell you what to do within your unit. So with our washrooms and some of these other things, it's very necessary that we take responsibility for it, and then at the very least, you can write and make sure that your observations on some of these things are captured, and then it can be sent up. So we thank you so much. It's been very insightful. And on our part, we will do our best to make sure that not just even these policies, but for all the others, we get to know what is in there, and we will try to implement them so that the units and KNUST as a whole functions very effectively. Thank you.